Well, new right now, the South Carolina Attorney General's office says our state law regarding paid parental leave also applies to parents who experience a stillbirth. This opinion comes after concerns from teachers and state employees who were being denied leave following a stillbirth, despite going through the same medical event as other parents. The AG's office says the General Assembly clearly intended for the word birth to include stillbirths and that to rule otherwise would be, quote, absurd and unjust. The opinion notes that giving birth to a stillborn child is physically the same as giving birth to a living child, only far more traumatic. They also add parents deserve the same time and benefits under the law. Although the opinion is advisory, the AG's office is urging lawmakers to clarify the statute. That way, grieving parents are not forced to fight for benefits they were promised. And the opinion from Alan Wilson is in response to a state lawmaker who asked the state attorney general to go ahead and clarify a law about parental leave for teachers. A 2023 law guaranteed teachers 6 weeks of paid parental leave, but Representative Neil Collins says he knows of 3 instances where school districts denied that leave to teachers who had a stillbirth. Dr. Kelly Russin with the USC School of Nursing, like many other women, Dr. Russin had stillbirth herself around a week before her child's due date. Listen here.
No matter where they are in their pregnancy, they have to take care of their body, and they can have fatigue, changes in their appetite, sleep problems, and just everything that goes with having a delivery. They are very likely, by research, to have, they are more likely to have complications after their delivery, like hemorrhage, infection, and even death. So they have to be watched very closely, and they have to take care of themselves very well.
We also want to mention that Collins has declined to identify which districts he knows of that are interpreting the statute that way. But he says he does plan to file follow-up legislation to clarify the law when lawmakers return, and that happens in January. And September is also Infant Mortality Awareness Month, and earlier today, Prisma Health hosted a special event to honor families who have experienced loss. Community members gathered over at the Richland campus flagpole for an infant mortality awareness bubble release. The event remembered babies who passed before their first birthday and highlighted resources available to expectant mothers through Prisma Health's Healthy Start program. Tonight, Prisma Health's director is explaining how early prenatal care and support services are key to lowering risk and saving lives.
Okay. So we've been around, and I've actually been here for the over 28 years that Healthy Start has been here at Prisma Health. And Healthy Start in general has been in existence for about 30 years. And over those years, from the areas that we're in, and so we make sure that we link everyone to the resources. They have a person that can work with them, I say, from pregnancy until the baby turns 18 months of age. So when you find that we've been involved in the communities and working with those individuals, if you look at our data shows that the individuals that have been in our program have greater successes than those that were not in the program.
Well, state data shows nearly 400 infants died before turning 1, both in 2022 and in 2023. Black infants, however, continue to face the highest mortality rate. That is more than double that of white infants.